Now, we just want to look at a connection between several disease conditions and how they can be able to cause heart failure in children. So, sorry, this is not acute. This is just one acute. I did a typo. So, for the next disease which we are connecting with heart failure in children is acute lower respiratory tract infection. So, we are looking at, okay, this acute lower respiratory tract infection, how can it be able to now go to cause issues in children? So when they say upper respiratory tract, so from your nose down to the throat and all, lower respiratory tract, we are talking about down, the bronchioles. You understand? So if there's an infection here, how can it be able to cause heart failure? All right. So let's look at the bridge between these two organs. So acute lower respiratory tract infections like pneumonia, bronchiolitis, bronchitis, all of them just have to do with there's difficulties in breathing, right? So they can definitely lead to heart failure in children, especially when the infection is severe. All right, do you understand? Or the child also have other accompanying disease conditions that is making them much more vulnerable to the acute lower respiratory tract infections. So how they can lead to heart failure is what? Hypoxia induced cardiac stress. So because this child is struggling to breathe, because oxygen supply is not, how will I put it? It's not enough to all the tissues. All right, it can impair gas exchange in lungs, leading to low oxygen levels. All right, now the heart compensates by pumping faster and harder. Do you understand? So it's now putting too much work on a young heart. All right, so prolonged hypoxia weakens the heart muscles, so it leads to what? The heart muscles becoming dysfunctioned. All right, so that's one reason. Let's look at the next reason. Pulmonary hypertension. So inflammation and infection in the lungs can cause vasoconstriction of pulmonary vessels. Now this raises pressure in the lungs, straining the right side of the heart, which deals with deoxygenated blood that usually sends this deoxygenated blood to the lungs for oxygenation. But the lung muscles, the lungs vessels, that's blood vessels, they are becoming smaller, they are becoming vasoconstricted. So the heart is trying to communicate with the lungs, but there's this resistance. Do you understand? So over time, it results in failure of the right side of the heart. Systemic inflammatory response. So as you have infections, your immune system is trying to tackle it and all. So there's a whole lot of cytokines being released. If it is too much over time, it's called cytokine storm. So this can depress heart function directly, cause vascular leakage, leading to fluid overload and congestive heart failure. Fever and tachycardia. So fever increases metabolic demands and the heart responds with what? Beating too fast. So in children with borderline cardiac function, this can precipitate acute decompensation. Underlying congenital heart disease. So if the child has other issues in the heart, they are much more vulnerable. So the acute lower respiratory tract infections can just make it easier for them to actually just go into heart failure. All right, so these are reasons why acute lower respiratory tract infections can cause heart failure.